If you have original Medicare, you have Part B, and you have a very large network. What are the three provider types, though, within that network? Why should you care? And let me share some tips to help you along. Welcome, I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I offer solutions, insights, and strategies to patients like you. So this video is only for original Medicare members. Those who have Medicare Advantage, also called Part C, alas, cannot use this original Medicare network. A quick refresher first. Part B. These are the services by a professional or rendered outpatient in a hospital, but also the supplies used to diagnose and treat a medical condition, as well as the services to prevent or detect a potential medical condition before it gets too late. So Part B will include mostly doctors of any specialty, but also durable medical equipment, for example, a wheelchair or crutches, also drugs infused or injected as part of an outpatient hospital stay in an infusion center or even doctor's office. And Part B also will cover you for ambulance services, mental health treatments, and more. The three types of provider within that huge network are called participating, non-participating, and opt-out. Let's start with participating. This is by far a huge number of physicians in the States. Why? Because a practitioner is automatically enrolled in the Medicare network unless they specifically opt out. But those participating providers, about 98%, accept Medicare and always accept what is called assignment. It means they accept what Medicare approves as a fair price for their service as payment in full. They accept the Medicare payment, which is 80% of that allowance, and to only bill you or your Medicare secondary carrier, if you have one, for the remaining 20% copay. A non-participating provider does accept Medicare, but only accept assignment on a case-by-case basis. For example, they may accept a Medicare-approved amount for an office visit, but for a subsequent surgery may not. Or your services may be covered as participating, but may consider non-participating services to be rendered to your neighbor. The last and by far smallest portion of Medicare providers is called opt-out. This means the provider has submitted an affidavit to Medicare opting out of the Medicare system. They never accept Medicare. They never accept assignment. And therefore, they can charge their clients or patients whatever they want, as far as they meet certain criteria. So what does all of this mean exactly for your wallet? Well, participating providers are the very best option to save you the most amount of money. The providers submit a claim directly to Medicare before they can charge you anything. Medicare processes the claim by applying a specific allowance to every service or item. The explanation of benefit that is issued will then show an 80% payment to the provider and a 20% copay to the member. And yes, you might have a small deductible at the beginning of the year. If you have a Medigap secondary insurance, that should cover that 20% and deductible. If you use a non-participating provider, well, it's a question of yes or no. if they are accepting assignment for that service or item, it falls under participating. You will just be liable for the 20%, or your secondary insurance will. If they don't accept assignment, they can only charge up to 15% more than the Medicare approved amount. You may be now responsible for 35% copay, as Medicare will still pay whatever they would have paid for a participating provider, but charging you that additional 15% known as a limiting charge. Some states will limit that limiting charge to even less than 15%. And to find out what are the regulations in your own state, consult the SHIP website. This is the State Health Insurance Assistance Program. It will give you that information, but also direct you to resources and other programs to help you save even more money. Non-participating providers should still bill Medicare so they can get paid and also determine how much your liability is. If they don't bill directly, you can submit an invoice to Medicare in order to get reimbursed. In case of opt-out providers, you are responsible for the entire cost of the services or items. You should be receiving, though, an ABN form. That form describes ahead of time what charges are not going to be covered by Medicare because the provider is opted out. It also gives you a dollar amount for each one of those services or items. It will ask you to sign to confirm your acceptance of the financial responsibility for the full cost, as well as confirm your understanding that Medicare will not reimburse you. I have a special video on the ABN form. Now, of course, this is healthcare, so there is an exception. In case of an emergency, should you need to hire or use an opt-out provider, Medicare would cover that cost. But remember, opt-out providers do not bill Medicare, and therefore you cannot get reimbursed. And even if you were to submit an invoice yourself, those services are not covered. Now for some tips. Try and find out ahead of time what status the provider has, especially if non-participating. Will the services you are about to have be billed to Medicare as participating or non-participating? The difference means 15% of the Medicare allowance at your cost. There is always paperwork such as the ABN form, that prior notification. There are several types for home health services, for professional services, skilled nursing facility services, and even outpatient hospital services. You can also find out for sure by visiting my favorite website, medicare.gov. You can find a provider meeting your needs or compare a number of specialists in your area to find out which one is participating or might have opted out. Of note, if you need the services of a clinical social worker or physician assistant, they can only be participating or opt out, but never non-participating. And as a last reminder, Medicare Advantage members cannot use the national Medicare network. They are bound by their private insurers network, which are usually much smaller, local, and stricter, and especially if under HMO status. So thank you for watching. Your likes, comments, and subscribes help this little channel grow to reach out to many more patients just like you. So thank you.